Friday to you, and welcome back to another installment of the Friday Five here on the Agent Survival Guide podcast. This is our weekly list of 5 things you should know about. I'm your host, Sarah Ruppel, and today is Friday, June 19th. We will kick off this week's list with a certification reminder for those selling Medicare Advantage and Medicare Part D plans this annual enrollment period. Both AHIP and NABIP certification for the 2027 enrollment season will open on Monday, June 22nd. We have recently published some episodes around that certification info, so you'll find those links in the notes. There are some helpful tips and information in those episodes and blog posts. Whether it is your first time certifying or you've been doing this for a couple of AEPs now. Moving on to another quick mention. Microsoft Teams announced automatic location tracking a few months ago, but then delayed the rollout of the feature. Now it looks like this feature is rolling out, and for some, it will be automatically turned on. Others might be able to opt out. It all depends on whether your controls are controlled by you or your company. Teams currently has the ability to input your work location from Outlook, but that feature is manually controlled and it is not mandatory. Teams would essentially be tracking location by the network you're logged into and automatically updating that setting. We work on a hybrid schedule here at Ritter Insurance Marketing, the FMO that powers this podcast. And I try to keep my schedule updated in Outlook because of scheduling guest interviews and meetings. But I have to admit that I don't always remember to do that. Sometimes I do have to swap my work at home days around depending on what my family's schedule looks like for that week. So to be honest, this would be helpful knowing that I don't have to worry about manually adjusting for that. But there are a lot of privacy concerns that come along with features like this. Many of the pieces I read on this new feature pointed that out, and I think that is a fair concern. Something that is coming soon that we've been thinking a lot about lately, especially now that we are halfway through the month. July 1st is right around the corner, and that is the start date for the Medicare GLP-1 bridge to begin. We've reported on the balance model, the Medicare GLP-1 bridge, the delay to balance, and then the extension of the Medicare GLP-1 bridge in response to that. But all of that information is sprinkled in a few different episodes. We will be linking to those in the notes for this episode, but we do have a standalone episode detailing all that information in the works. We also have some blog posts and content library pieces in the works, so make sure you're following along with us to get the notifications of those resources when they are available. One thing that I read about this week that really struck me, it's from an Axios piece that is linked in the notes. For the Medicare population, the problem of quickly losing weight and how that can affect the body. Just something to keep in mind if you happen to have clients who plan to take advantage of the Bridge program. Weight loss management benefits are not available in every plan type. One thing I would suggest over the next few weeks, do a little digging in your local area to see if any providers or community centers are offering workshops on the topic. And I would stick to meetings held by qualified professionals. And if you have one in your area, that could be a great resource for your clients who don't have a covered benefit, who still want to learn about managing their health. And if you don't see one available, but have a partnership with a local provider or professional, maybe suggest this as a topic in exchange for you coming in and presenting an educational event on Medicare basics. As I mentioned, we've got a few new resources in the works that we'll be talking about here on the show, so make sure you're following along with us and check out what we do have available right now linked in our notes. Next up, 2026 marked the beginning of the Medicare drug price negotiation program. We have been covering this CMS program for quite a while now, dating all the way back to the Inflation Reduction Act. When it was first announced, CMS outlined what the first 4 years of the program would look like, taking us to the end of 2029. And this week, CMS announced their plans to codify the Medicare drug price negotiation program, making the changes permanent and adding 2 small changes. For coverage year 2029, the IRA will allow for 20 Medicare drugs covered either under Part B or Part D. That number will stay the same for coverage years 2030 and beyond. So each year, CMS will have the ability to choose 20 Medicare Part B or Medicare Part D drugs to participate in the negotiation program. CMS proposed other small changes to the program, one of which they are calling the temporary floor for small biotech drugs. This temporary floor, quote, limits CMS from offering or agreeing to counteroffer for a maximum fair price for small biotech drugs below the floor for certain eligible drugs during initial price applicability years 2029 and 2030. This policy supports continued innovation while maintaining fairness for small biotech companies, end quote. Another CMS proposal, codifying a requirement that Medicare Part D drugs selected for Medicare drug price negotiation be included in Part D formularies. CMS also plans to codify quite a few definitions, one of which they highlighted in their press release, the definition of negotiated price, outright naming concessions and fees that are included while excluding factors that might increase the price. So essentially, trying to keep the prices from being adjusted behind the scenes after they've gone through the negotiation program. CMS defined quite a few terms in their proposed rule in addition to other details. If you would like to read the full legislation, we will have that linked in our episode notes. Also there, you'll find links to the official CMS documents on the program and other resources. Our top story this week actually began on Friday last week when a district judge in Maryland struck down quite a few provisions included in the CMS 2025 Marketplace Integrity and Affordability Final Rule. The lawsuit was backed by the City of Columbus, their mayor, the City Council of Baltimore, the City of Chicago, and advocacy groups Doctors for America and Main Street Alliance. Couple of provisions to mention here, and we have touched on most of these before when reporting changes coming to the ACA marketplace. But these provisions will no longer go into effect. First up, beneficiaries receiving the advanced premium tax credit and passively renewing their coverage in a $0 premium plan would have been charged a $5 premium penalty for not updating their information and essentially letting the system double-check that they are still eligible for those credits. That premium penalty will no longer go into effect. Next one, individuals with past due premiums may not have been able to enroll in new coverage without paying their past due premium amount and the initial premium payment. The rule was going to be up to carrier discretion, but was vacated. So past due premium amounts should not hinder an individual's ability to enroll in ACA coverage. And while we're on the subject of those advanced premium tax credits, or APTC for short, the 2025 final rule shortened the timeframe for tax filing and APTC reconciliation from 2 years to 1 year. And for those who did not reconcile within that time frame, they would no longer be eligible for APTC. That change has been vacated by this new ruling, and we are back to the 2-year time frame for individuals to file their taxes and reconcile their APTC on those returns. Our fourth vacated provision, stronger income eligibility verification processes on special enrollment period enrollments. In their attempt to crack down on fraudulent marketplace enrollments, CMS began conducting, quote, pre-enrollment verification for SEP eligibility, end quote, and also implemented a 75% threshold for pre-enrollment eligibility verifications on new federal marketplace enrollments, with the plan to sunset this practice at the end of 2026. The ruling in this lawsuit against CMS vacates that decision, so this change is effective immediately. This next provision is one that agents selling in both the Medicare and ACA markets are likely thankful for, vacating the decision to shorten the ACA open enrollment period. This year, we were going to see enrollment dates switch back to November 1st through December 15th. With this new ruling, we are back to the rules that we're used to for ACA enrollment. Open enrollment begins on November 1st, and it ends on January 15th. December 15th is the last day to enroll for a January 1st effective date. Enrollments taken between December 16th and January 15th will have a February 1st effective date. Keeping it moving here, and we're back on household income reporting, this time focusing on inconsistencies between self-attested income and actual income reporting. CMS had revoked the 60-day extension that previously existed beyond the 90-day window individuals get to resolve discrepancies in an income inconsistency report. That 60-day extension is back. And that leads nicely to the next provision being vacated. Exchanges will not be required to verify household income inconsistencies. The example here that we used a few weeks back in our reporting, when trusted data sources show that an applicant's income fell under 100% of the federal poverty level, yet their application attests that their household income is above 100% of the federal poverty level. Exchanges will not be conducting those verifications. And then the last one, CMS cannot make the changes outlined in the 2025 Marketplace Final Rule that would have changed the de minimis ranges for actuarial value calculations. In our original reporting, we mentioned that CMS cited their attempts to fight fraud, waste, and abuse, as well as increase government efficiency as reasoning for these new requirements. Interestingly enough, the judge presiding over this lawsuit sided with the plaintiff's arguments that, in fact, some of these provisions did not increase efficiency and actually hampered the marketplace from doing what it initially set out to do: provide Americans with affordable healthcare coverage. Couple more things that I do want to mention here. First one, and this one I have to give a shout out to Rox because she is the one who sent it over to us as a reminder. She's our content manager here at Ritter. And it's our fun fact for today. When a federal judge vacates a rule, that decision stands on the federal level as well as the state level. So what goes at the federal level also goes at the state level where this particular ruling is concerned. Also, important to remember that the government can appeal this ruling. They also have the ability to address some of these issues in future proposals. We will continue to follow along with these and other changes, and we will report back here in future Friday 5 episodes. So be sure to listen to those. And if you're not already, we would love it if you would follow along with the show. It is a great way to let us know that you like what you're listening to, and it helps us keep the lights on here at the podcast. That all being said, I just want to say thank you so much for listening to this installment of our show. I hope you have a great weekend. Stay healthy and stay safe out there. Enjoy the last weekend prior to kicking off certification season for the 2027 coverage year. And we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Emily Ryan. Podcast design by Urban Rivera. Like what you hear? Follow along with our show wherever you get your podcasts.